Okay, let's move on to bone grafting. I don't have much to say here. We know that bone cancellous bone grafts are relatively simple, and they do hasten bone healing. That's been shown. We also know that they don't really require much in the way of instrumentation. I'll show you in the video, but they do require pre-planning. You have to have decided before you do the surgery that you're going to do this. When you look at the top left-hand picture, you can see in a left humerus there a cut section. It's that proximal cancellous bone that we're getting into. I'll show you in the video in just a sec. The distal pictures, you can see there's a big bone defect there. This is a distal femoral fracture, and in the right-hand picture it's been filled with cancellous bone. So if you are opening the fracture envelope of a comminuted fracture, I would encourage you to bone graft it. The decision making is that should be bone grafted. Train your nurses that if they've, get them to have a look at the radiographs. If there's a comminuted fracture, they should be clipping this dog for a bone graft rather than waiting for you to decide in surgery, or now we need a bone graft done. Okay, we'll have a look at this this video. This is the left humerus of a dog, so the head is to your left, and we're making an incision over the proximal humerus there, and we're incising cranial to the deltoid muscle. The deltoid muscle comes off the acromial process, and when we dissect through the loose fascia, we're looking for this tendon of the infraspinatus. You can see that's the tendon right there. It's a very flat white tendon, and that's really an arrowhead to say where we should be going into the bone. So we just use the very tip of that tendon as the entry point, and whether you use a drill or, in this case, I prefer to use just a Steinman pin on a Jacob's chuck. Very thin cortical bone there. It's easy to get through, and use a bone scoop. I prefer to use an oval bone scoop. You just get more out, about the same size as the Steinman pin or the drill bit that you use, and you'll see the two Gelpi retractors there. It's really important to make sure that the soft tissue stays open around your bone graft site, because as happened in that first grab that we took there, often the soft tissue can wipe away the bone graft, and you lose it under that soft tissue. But this is a matter of just getting used to the feel of cancellous bone. It's hard to do to cause a problem with bone grafting. People have put the curette through the far wall, but it's really just a matter of feel. This is obviously a cadaver. There's no bleeding. In a live animal, this is much redder, and there's some bleeding. It's not difficult to control. We don't close the bone graft hole. All we do is close the subcutaneous tissue and the skin when we're done, and then that's it.